People with uncontrolled diabetes may develop poor circulation, and this in turn can lead to more severe problems: heart attack, stroke, kidney problems, Montel, even diabetic foot ulcers.
It's crazy. Well, today we're going to be talking about diabetes and why millions of Americans are suffering from wounds that just won't heal.
Joining us today is Cindy Miller, registered nurse and global medical translational lead for 3M Medical Solutions.
Thanks so much for being here today, Cindy.
Thank you for having me.
Cindy, let's just talk about diabetes. It's such a devastating disease, and we really have to create awareness about it.
It is amazing. There are millions of Americans that most likely have type 2 diabetes and they're not even aware, because it really is without a lot of symptoms early on, and that's where we want to intervene. We want to intervene early before all those circulatory changes you just mentioned happen to the heart, the brain, and even the foot.
Absolutely. Well, look, we brought some pictures with us today of foot ulcers, but tell us what causes these ulcers and how dangerous are they?
Well, those very circulatory changes that we talked about just a minute ago actually impact the nerve endings as well in the foot. And because of that, we end up with, many of our diabetics have either burning or tingling, it's called neuropathy, or they end up with total lack of sensation. And when you don't have that protective sensation, things can rub on shoes. You can step on something sharp or hot and not be aware of it. When that skin has a break in it, bacteria can get in and you can end up with an infection and develop a diabetic foot ulcer.
You talked about intervening early, which is so important, and 3M Medical Solutions is helping patients do that. Let's talk about that.
Yeah, you know, thank you for asking that. The interesting thing about 3M is when we think of 3M, we think of Post-it notes.
That's what I thought of. The little yellow thing.
Yes,
right?
yes, all sorts of colors. Or Scotch brand tape, or the command hooks and strips.
That's the one I think about.
Yeah. So you don't like pull a big hole in your wall or have to hammer things in. But many people are unaware that we have an entire healthcare business group. I work in the Medical Solutions Division, where we have hundreds of scientists and engineers and physicians and nurses who work to develop patient-centered scientific answers to help enhance healing.
And we have some here.
Along, right?
Yeah, we did. In fact, for the really easy to use, your physician who we work with and work on training programs have things that are easy to access for that smaller wound so it doesn't develop into something big. Or if the wound is more aggressive or assertive, there's advanced products like the 3M Active-Act Therapy System.
Wow, talk to me about how it works.
Well, this is a really wonderful product in that the granufoam, the 3M VAC granufoam, would be cut to fit inside of the ulcer. Then they would place a strip of what's called the VAC Dermatac drape over that, cut a little hole, connect it to this therapy unit, and the therapy unit applies a suction or negative pressure. As the air is pulled out of the granufoam gets smaller, pulling the wound together, pulling out the exudate or wound drainage and infectious materials and storing them in the canister. The dressings change 3 times a week, and the doctor will watch how that wound progresses towards healing.
And what are some of the risks associated with this kind of treatment?
As with any medical device, there are some risks and benefits, and one of the things that, because this is a physician-prescribed therapy, the physician who's well-trained in the risks and benefits will discuss it with the patient so they can make an informed decision.
That's what we want. We want patients to get better. Cindy, I also want to talk about the Patient VAC Therapy website, the app, which is amazing, and it's called My Wound Healing. Share that with us.
We love to help educate. That's what we feel, that early awareness that you were talking about. So those of your viewers who, even if you're not diabetic or you don't have a wound, you can go to mywoundhealing.com and you'll find videos, you'll find patient stories and testimonials, you'll find more about the science of how and why it works. And then those patients that do actually have Active-Act therapy prescribed for them can download an app to their phone. And they get to have a collaborative interaction with the tasks, with mechanisms of action, with frequently asked questions. There's 24/7 support. So it's a wonderful way for us to continue to support the patient on their wound healing journey.
Speaking of patient, would you mind just sharing, and I know you can't say names, but what feedback do you get? They must be so thrilled.
It is a wound, like you said, Montel, that is so hard to heal. When you have diabetes, any wound on your body, but especially on the foot. And so to feel that there's hope, when they see the doctor be pleased with how the wound is looking instead of it being chronically stagnated, it gives them that, because I think hope is the answer to many things, to continue the therapy that the doctor has prescribed. You know, 3M encourages all of your viewers to engage with their healthcare team regarding their risks for diabetes, as early intervention can make so much difference in their health. If you or anyone you know has or develops a wound, please know that 3M has a wide range of wound solutions to help your healthcare provider select the appropriate therapy.
Well, we can't thank you enough for being here. And thank them for all the hard work that they're doing. And of course, if you want more information, you can go to our website, thebalancingact.com.
Thank you so much for being here.
Thank you. It's my pleasure.
Do appreciate it.
Thank you so much.
Do appreciate your time.